Hi everyone, this is the second part of my first lecture of the lower limb, the anterior and medial thigh. So already I mentioned that within the thigh, there is skin, superficial fascia, deep fascia. Deep fascia of the thigh is called the fascia lata. And from the deep fascia of the thigh, there are intermuscular septum, the extensions of the deep fascia of the thigh. There are intermuscular septum, and there are three intermuscular septum which divides the thigh muscles into three different compartments. So the three intermuscular septums are lateral intermuscular septum, medial intermuscular septum, and the posterior intermuscular septum. And in between these three intermuscular septums, there are three different compartments of the muscles of the thigh. And these intermuscular septums, they are attached to the femur. So this is the cross section of the thigh. So this is the cross section of the femur. And these are the compartments of the muscular compartments of the thigh. So on the anterior aspect of the femur is the anterior compartment of the thigh. And this is the largest compartment, which lies in between the lateral and medial intermuscular septum. This anterior compartment of the thigh is also called the extensor compartment of the thigh. And medial to that, in between the medial intermuscular septum and the posterior intermuscular septum, this is the medial compartment of the thigh, which is also called the adductor compartment of the thigh. And the posterior compartment is the smallest one. It lies in between the lateral and the posterior intermuscular septum. So the anterior compartment of the thigh, it includes this muscle. These are the muscles of the anterior compartment of the thigh, the iliopsoas, sartorius, and quadriceps femoris. Pectineus is a small triangular muscle which lies in between the anterior compartment and the medial compartment. So we can consider the pectineus muscle is a transitional muscle in between the anterior and medial compartment, and that's why it receives its nerve supply from both the anterior compartment nerve and the medial compartment nerve. And the iliopsoas muscle, you know that it is the combination of the iliacus and psoas major muscle. Most of this iliacus and psoas major muscle is lying on the posterior abdominopelvic cavity. Iliacus from the iliac fossa and the psoas major from the lumbar vertebral bodies. And then they join together, iliacus and psoas major, and form the iliopsoas, enters into the thigh under the inguinal ligament. Iliopsoas muscle forms the lateral part of the floor of the femoral triangle, and medial part of the floor of the femoral triangle is formed by the pectineus. Distally, iliopsoas is attached to the lesser trochanter of the femur. Iliopsoas is one of the chief flexure or major flexure of the hip joint. It also helps in maintaining the normal lumbar lordosis during a standing position. Sartorius is another muscle of the anterior compartment. It is a long ribbon-like muscle. Extends from the anterior superior iliac spine. It crosses obliquely from lateral to medial, and distally it is attached to the medial side of the upper end of the tibia. Sartorius is the longest muscle of our body. It is a flexure of the hip joint. Also, it helps in flexion of the knee joint. The actions of two sartorius muscle brings the lower limb into cross-leg sitting position. Sartorius, this muscle forms the lateral boundary of the femoral triangle. Then the large quadriceps femoris. Quadriceps femoris, it is a four-headed femoral muscle. It has four different parts. The most superficial part is the rectus femoris. Then medial to that is the vastus medialis. Lateral to that is the vastus lateralis. And deep to the rectus femoris, see in this illustration you can see deep to the rectus femoris is the vastus intermedius. The vastus lateralis, vastus intermedius, the vastus medialis all are attached to the anterior, medial, and lateral surfaces of the shaft of the femur. The rectus femoris is the only part of the quadriceps femoris which has its proximal attachment to the hip bone. It is attached proximally to the anterior inferior iliac spine of the hip bone. And all these four different parts of the quadriceps femoris muscle, they form a common tendon, which is the quadriceps femoris tendon, which is attached inferiorly to the base of the patella. Patella, or the kneecap, it is a sesamoid bone, and from the apex of the patella, the quadriceps femoris tendon, it extends inferiorly and distally it is attached to the tibial tuberosity, which is a bony prominence on the anterior aspect of the upper end of the tibia. And this extension from the apex of the patella to the tibial tuberosity is called the patellar ligament, or ligamentum patelli. Patellar ligament is the extension of the tendon of the quadriceps femoris muscle. So quadriceps femoris muscle tendon has this sesamoid bone. Patella is the largest sesamoid bone of our body. It lies within the tendon of the quadriceps femoris muscle. And this patellar ligament, it is used for the knee jerk. The physician, they use their hammer. By tapping this tendon, they test the function of the femoral nerve. Also, they test the knee jerk. And the knee jerk is indicating that the femoral nerve, the L234 segment of the spinal cord, is working well. Knee jerk is to test that the function of the femoral nerve, the knee jerk is used, or patellar tendon reflex is used. So all these muscles of the anterior compartment, they get their nerve supply from the femoral nerve. Femoral nerve, you know, it is the largest branch of the lumbar plexus. It arises in the abdominopelvic cavity, and in the abdominopelvic cavity, it lies in between the psoas major and iliacus muscle. Then the femoral nerve, it arises from the L234 segment, lumbar segment of the spinal cord. And then the femoral nerve, it enters into the thigh inferior to the inguinal ligament, and it lies lateral to the femoral artery and femoral vein. It is the most lateral contents of the femoral triangle. Femoral nerve, after entering into the thigh, it divides into several branches. It supplies all the muscles of the anterior compartment, the sartorius, quadriceps femoris, iliopsoas, and also it supplies the pectineus muscle. Part of the pectineus muscle get the nerve supply from the femoral nerve. Femoral nerve also give rise the anterior cutaneous branches. The anterior cutaneous nerves supply the skin of the anterior part of the thigh. And there is another important cutaneous branch of the femoral nerve, which is called the saphenous nerve. The saphenous nerve, it arises from the femoral nerve in the upper part of the thigh, and then it courses with the femoral artery and femoral vein. It courses with the femoral artery and femoral vein, and then it becomes superficial at the medial side of the knee. It pierces the muscle and the fascia, and it becomes superficial, and in the leg it descends or it courses along with the great saphenous vein superficially. Saphenous nerve is another cutaneous branch of the femoral nerve. Already I mentioned in my first section of my first lecture that it supplies the medial side of the leg and the medial side of the foot, and it courses in the leg along with the great saphenous vein. Femoral nerve, it supplies all the muscles of the anterior compartment of the thigh, and these muscles are the extensors of the knee joint. The quadriceps femoris especially, this is the great extensor of the knee joint. And in case of injury of the femoral nerve, what will happen? It causes the loss of cutaneous sensation in the anterior surface of the thigh. Also, there will be their inability to extend the knee, because these are the extensors of the thigh. and atrophy of the muscles of the anterior thigh. And also there will be absence of knee jerk, because I mentioned that knee jerk is to test the function of the femoral nerve. So femoral nerve is the nerve of the anterior compartment. And the blood vessels of the anterior compartment is the femoral artery and the femoral vein. You already know that the femoral artery is the continuation of the external iliac artery. And the femoral vein is continuous. When it crosses the inguinal ligament, enters into the abdominopelvic cavity, it becomes external iliac vein. So femoral artery and femoral vein, it lies in the femoral triangle. And femoral artery and vein, they almost bisects the femoral triangle. We can feel the femoral artery pulse under the inguinal ligament in between the anterior superior iliac spine and the pubic tubercle. It lies in the middle position. Femoral artery and vein, it bisects the femoral triangle. And from the apex of the femoral triangle, so see, here is the sartorius adductor longus femoral triangle boundary. And from the apex of the femoral triangle, the femoral artery and vein, see, this is adductor longus, sartorius muscle, femoral artery and vein, they courses through a fascial tunnel. There is a intermuscular passageway or fascial tunnel in between the muscles of the anterior and the medial compartment of the thigh, and that is called the adductor canal. The adductor canal, it is also called subsartorial canal because it lies deep to the sartorius muscle, under the sartorius muscle. So adductor canal is a intermuscular passageway which lies under the sartorius muscle, and adductor canal extends from the apex of the femoral triangle up to the adductor hiatus. Adductor hiatus, I will show you in a minute. It is an opening in between the two different parts of the adductor magnus muscle. So adductor canal or subsartorial canal, it lies deep to the sartorius muscle and it contains femoral artery, femoral vein, and also these nerves. This is the saphenous nerve and the nerve to the vastus medialis. These nerves are also coursing through the adductor canal. So femoral artery, femoral vein, they are coursing through the femoral triangle, bisecting the femoral triangle, and from the apex of the femoral triangle, they are passing through the adductor canal, and then at the distal part of the adductor canal, they leave the thigh through the adductor hiatus. The saphenous nerve, I mentioned that it is a branch of the femoral nerve. It courses with the femoral artery and femoral vein, but it leaves the femoral artery and vein distally and it becomes cutaneous or more superficial on the medial side of the knee. So femoral artery and femoral vein are the only structure which passes through the adductor hiatus. And through the adductor hiatus, they are going to enter into the popliteal fossa, which is a depression or the fossa behind the knee joint. And femoral artery and femoral vein, when they enter into the popliteal fossa, they change their name. They become popliteal artery and popliteal vein. So here you can see femoral artery. It passes through the femoral triangle. At the proximal part of the femoral triangle, the femoral artery has some name branch. There are superficial epigastric artery, superficial external pudendal, and superficial circumflex iliac. These are the name branches of the femoral artery at the proximal part of the thigh. And also there may be deep external pudendal artery arises from the femoral artery. Then femoral artery has its largest branch. The largest branch of the femoral artery is called the deep femoral artery or the profunda femoris artery. Like the profunda brachiae artery is a branch of the brachial artery, the profunda femoris artery or the deep femoral artery, it arises from the femoral artery from its posterolateral aspect, from the posterolateral aspect of the femoral artery at the proximal part of the thigh, and then it descends, the deep femoral artery, it descends posterior to the adductor longus muscle. It descends posterior to the adductor longus muscle, and adductor longus muscle separates the femoral artery and femoral vein from its deep femoral artery branches. So deep femoral artery, you will see in the lab, it lies deep to the adductor longus muscle. Deep femoral artery normally it has two important branches, the medial circumflex femoral artery and the lateral circumflex femoral artery. The medial and lateral circumflex femoral arteries, normally they are, or usually they are the branches from the deep femoral artery, but sometimes they may arise from the femoral artery itself. You know that the circumflex means surround. The medial and lateral circumflex femoral artery, you can see they surround the neck of the femur. Their branches, they anastomosis with each other around the neck of the femur. So medial circumflex femoral artery is deep and lateral circumflex femoral artery is lateral. You will see in the lab very clearly the lateral circumflex femoral artery, but sometimes medial circumflex femoral artery is difficult to see in the cadaver. And the medial circumflex femoral artery and lateral circumflex femoral artery, they have ascending branches, and the ascending branches of these arteries, they anastomosis around the neck of the femur, and from these arterial anastomosis they send branches which goes through the joint capsule of the hip joint, and they enters into the hip joint and they supply the head and neck of the femur. Especially the branches of the medial circumflex femoral artery is one of the major source of blood supply of the hip joint. The lateral circumflex femoral artery, you can see it has three branches, ascending branch, the transverse branch, and the descending branch. The ascending branch ascends upwards anterior to the neck of the femur, and it anastomosis with the ascending branch of the medial circumflex femoral artery, which lies posterior to the neck of the femur. The transverse branch also anastomosis with the transverse branch of the medial circumflex femoral artery at the junction of the upper end and the shaft of the femur. And the descending branch of the lateral circumflex femoral artery descends. When it descends in between the rectus femoris and the vastus lateralis part of the quadriceps femoris muscle, and then this descending branch of the lateral circumflex femoral artery descends all the way up to the knee joint, and it participates in the formation of the genicular anastomosis around the knee joint. So medial and lateral circumflex femoral artery are the branches of the deep femoral artery. Then the deep femoral artery also give rise some perforating arteries. So there are 4 perforating arteries. 3 of them are the branches arises from the deep femoral artery. The 4th perforating arteries is actually the continuation of the deep femoral artery itself. We call them perforating arteries because they are piercing, or they perforate the attachment of the adductor magnus muscle. And perforating arteries, they pierces this attachment of the adductor magnus muscle from the medial compartment, and then they're going to supply, these perforating arteries are going to supply the posterior compartment of the thigh. I mentioned that the femoral artery, it ends by passing through the adductor hiatus, and then it continues on the posterior aspect of the knee, it continues in the popliteal fossa and continues as the popliteal artery. The medial compartment of the thigh, it includes the muscle. Mainly these muscles are the adductors of the thigh. There are adductor group of muscle, adductor longus. Deep to the adductor longus is the adductor brevis, and then the adductor magnus. There are 3 adductor longus, adductor brevis, and adductor magnus, and the gracilis is also considered as the medial compartment muscle. All this adductor group of muscle, they have their proximal attachment to the pubis. See, the body of the pubis and the ischiopubic ramus, and also the ischial tuberosity gives attachment to the adductor group of muscles. And distally, these adductor group of muscles have their distal attachment mainly into the linea aspera, which is a longitudinal ridge on the posterior aspect of the shaft of the femur. Only a small part of the adductor magnus has its distal attachment into the adductor tubercle, but most of the other adductor group of muscles, it is attached into the linea aspera of the shaft of the femur. Adductor longus. Adductor longus is the long adductor of the thigh. It is a triangular muscle. It arises from the pubis. Adductor longus forms the medial boundary of the femoral triangle. And deep to the adductor longus is the adductor brevis. Here you can see adductor longus is cut and reflected. And deep to the adductor longus is the adductor brevis. This is the short adductor of the medial compartment of the thigh. And then the largest one is the adductor magnus. See, it lies more posteriorly, and adductor magnus is the largest adductor muscle. It has two different parts. This large fan-shaped part or triangular part, which has an aponeurotic attachment into the linea aspera, and this part, large fan-shaped part of the adductor magnus, is called adductor part of the adductor magnus. And the adductor magnus also, it has a tendinous part. It forms a rounded tendon inferiorly, and this tendinous part of the adductor magnus is attached inferiorly into the adductor tubercle. Adductor tubercle is a bony prominence. It lies above the superior to the medial epicondyle of the femur. So, adductor magnus has two different parts. Adductor part attached to the linea aspera of the femur, and it is a large or broad aponeurotic part, and it has a tendinous part or the hamstring part of the adductor magnus, which has its distal attachment to the adductor tubercle. In between the attachments of these two different parts of the adductor magnus, see, this is the adductor part, this is the hamstring part. In between the attachment of these two different parts, this gap or hiatus is called the adductor hiatus. And you can see through the adductor hiatus, the femoral artery and femoral vein, these two structures are passing through the adductor hiatus. From the adductor canal, femoral artery and femoral vein, they are passing through the adductor hiatus and they are going to enter into the popliteal fossa. The most medial muscle of the adductor compartment of the thigh is the gracilis. Gracilis is one of the weakest member, and it lies most medially. It arises from the pubis, and distally it is attached to the medial side of the upper end of the tibia with the sartorius muscle. There is another muscle which is very deep, the obturator externus. Obturator externus muscle, also considered as the medial compartment muscle. And obturator externus muscle has its attachment over the external surface of the obturator membrane. The nerve of the medial compartment of the thigh is the obturator nerve. Obturator nerve is another branch of the lumbar plexus. Obturator nerve enters into the thigh through the obturator canal. You have seen you will see in the lab, within the obturator internus muscle, there is a canal, obturator canal, through which the obturator nerve and obturator artery, here you can see, this is the obturator membrane. Obturator foramen is closed by the obturator membrane, but it leaves a canal right there, and through the canal, the obturator artery and vein and also the obturator nerve arises from the lumbar plexus, and that enters into the medial compartment of the thigh through the obturator canal. And in the medial compartment of the thigh, it gives rise into two branches. There is an anterior branch of the obturator nerve and there is a posterior branch of the obturator nerve. Anterior and posterior branch of the obturator nerve, they descend anterior and posterior to the adductor brevis muscle. See, this is the adductor longus. This is cut and reflected, and deep to that is the adductor brevis, the short adductor muscle. And anterior to the adductor brevis muscle, you will see the anterior branch of the obturator nerve descends anteriorly. And the posterior branch of the obturator nerve, that descends posterior to the adductor brevis. So you can see this is the inferior border of the adductor brevis muscle, and here is the adductor magnus. So posterior branch coming out through the inferior border. And anterior branch and posterior branch of the adductor brevis muscle, they supply all the muscles of the medial compartment of the thigh, including the pectineus muscle. Pectineus muscle get the nerve supply from both femoral and obturator nerve. And adductor brevis is the key muscle to identify the anterior and posterior branch of the obturator nerve. These two branches descend anterior and posterior to the adductor brevis muscle. And the blood vessel of the medial compartment, the deep femoral artery. See, you can see here the femoral artery is cut and reflected, and you can see the deep femoral artery. Deep femoral artery descends deep to the adductor longus muscle over the adductor brevis muscle, and these are the perforating branches. See the perforating branches? The perforating branches of the deep femoral artery, they perforates the attachments of the adductor magnus muscle, and they supply the medial compartment. Also, medial compartment get the blood supply from the obturator artery. Obturator artery is a branch of the internal iliac artery. It enters into the medial compartment of the thigh through the obturator canal, and that also supply the blood supply to the medial compartment of the thigh. But mainly the deep femoral artery and its perforating branches, they supply the medial compartment of the thigh. So this is the summary of this section of this lecture. The anterior compartment, the large anterior compartment muscles, these are the extensors of the knee, and most of them, these are the flexors of the thigh. And the anterior compartment muscles get the nerve supply from the femoral nerve. The medial compartment muscles are the adductor group of muscle, and they get their nerve supply from the obturator nerve. And the blood supply, the anterior compartment muscles get the blood supply from the femoral artery and its branches, and the medial compartment muscles get the blood supply from the deep femoral artery and its branches, and also the obturator artery. I will talk about the posterior compartment in my third lecture. Thank you.